I guess my question would be, why would everybody not just use the Medicare Advantage plan? What's the big difference between the Medicare Advantage plan and the Medicare Supplement plan?
There's a couple differences that I always compare, and the first stop that we make on our list of differences between Advantage plans and Medicare Supplement plans is the network. When it comes to insurance, especially in retirement, one of the biggest questions people have is, where can I use this insurance? I do not want a limited network. If the wife and I want to travel to Florida, we want to be able to use our insurance down there. What's our network? On the Medicare Advantage plan side, when somebody chooses to enroll in one of those plans, they'll get one of two things, either an HMO or a PPO plan. These are network plans. That is not a good or a bad thing. That's just how they work. So if I go down that path, you better believe I want to get the largest network possible. That's one of the things we help people look at. Now, the networks on the Medicare supplement plans supplement original Medicare. So your network on a supplemental plan is whoever takes Medicare.
So you're basically everybody.
Anybody who takes Medicare. So you can be New York, California, Texas, Kansas, Missouri. Does not matter. If they take original Medicare, you can walk right in, and your supplemental plan is going to pay the bills that it says it's going to pay on that standardized chart for Medicare supplement plans. Mm-hmm.
Interesting. So basically, if I'll be kind of cheeky here for a minute, but
ahead, yeah.
if you're just going to sit around and you're not going to travel, you're not going to do anything, and the network includes your doctor and hospital, etc., and you never have any plans on doing anything different, then the Medicare Advantage plan might be the right plan for you.
Correct. And I will also tell you, so I've been doing this since 2013. Up until 3-4 years ago, the Medicare Advantage plan networks were what I would say small. You still can find plans that maybe they only work in 1 or 2 counties. 3, 4, 5 years ago, that was really common. Where, let's say I'm in the greater Kansas City area, I'm in Lenexa, Kansas. 3, 4, 5 years ago, I pick up a Medicare Advantage plan. It may only work in Johnson County, Kansas.
Well, people are going to be listening to this all over the country, so they need to be able to check with that, right?
Right. So back then, very small networks for the most part. What we have seen in the industry over the last 2 years is that you have two companies now that have nationwide networks on their Medicare Advantage plan. So when I told you that we're comparing Advantage and supplemental plans, there's a couple things we look at, and the first one is network. Medicare Advantage plans got a really negative reputation because they had very strict networks. Very competitive industry. All of these private insurance companies are pining for new business, so they're looking at how can they gain new clients. Well, one of the biggest things people want is a big network. So now we've got nationwide networks.
So removing the geographical boundaries is a big deal in reducing cost.
Mm-hmm.
And
limitations. People don't want to be limited. Yeah. You may have people that enrolled in a Medicare Advantage plan that would love to go travel, but they were terrified to.
So what happens if somebody goes and they start out and they say, I'm going to do the Medicare Advantage plan, and then a year, 4 years, 5 years, or whatever it is from now, they decide, I want to get away from the Medicare Advantage. That doesn't fit me now. I want to go to the Medicare Supplement. Are there restrictions on switching from one to the other?
There absolutely can be. So when somebody first joins Medicare, they've got a guaranteed issue period to basically do whatever they want to. They can pick up a Medicare Supplement plan, Medicare Advantage plan, doesn't matter. This is when they're brand new to Medicare. Once they're outside of that 7-month window, so let's say age 66, 67, a couple years down the road, if they want to switch from a Medicare Advantage plan to a Medicare Supplement plan, they can, as long as the Medicare Supplement insurance company will issue them a policy, and that's going to be contingent, usually based on their health. So they'll ask health questions. So the answer isn't as simple as, well, of course you can change later down the road.
You can if you're healthy.
Perfect. Exactly. If you're perfectly healthy, you're not going to have any problems at all.
Interesting. So that would be a drawback to the Medicare Advantage plan, and then hoping that you could switch to a Medicare supplement plan. Like, let's say, for an example, I got my mom living in Kansas. I decide I'm going to move to Florida because I hate the winters in Kansas, and then I want to move mom down to Florida, and she's on an Advantage plan in Kansas that doesn't have any of her network in Florida, but now she's sick. She's stuck.
She would, if she wanted to move down there, their Medicare Advantage plans are highly regulated by the government. They're going to open up what's called an SEP, a special election period for her. So if you move out of your region or out of the area that you first picked up that Medicare Advantage plan in, doesn't matter what time of the year, they'll let you pick from any of the Advantage plans in the new place that you're moving to.
Okay,
so you will be able to.
There is some flexibility then.
Absolutely.
If you're talking to somebody who's approaching Medicare age, how do you help them decide whether the Advantage plan or the supplement is better?
I let them do the decision making. I just educate them on exactly what these main differences are. People are smart enough to make their own decisions as long as they know what those decisions are, when they know what the difference between their options are. But the categories that you're comparing between Advantage plans and supplemental plans are going to be network. It's going to be your monthly premium. It's going to be your maximum out-of-pocket costs. It's going to be prescription drug costs. Usually those are the four main things that go into this proverbial pot where we're able to then take a look at, what are your actual out-of-pocket costs going to run you? Because out-of-pocket costs with health insurance are not just your monthly premiums. So if I've got somebody who has some chronic conditions, maybe they go see a handful of specialists frequently, one of those two avenues may be better for that person cost-wise over the course of their life.
So your main focus is, can we provide the right coverage, and is the right coverage more valuable, or is the savings of premium more valuable? That's kind of what I'm hearing from you.
You are absolutely right, because they go hand in hand with each other. When you're on Medicare, you're either retired or you're getting ready to retire. You have to take into consideration your expendable income. What do you have, or your disposable income? What do you have access to? You don't want to be what we call insurance poor. You don't want to go out and get the best health insurance plan out there if that means that you can't put, food on the table.
Starting your route to retirement.